Good morning and welcome or good afternoon and welcome everyone. We'll let folks get settled in and we will be starting momentarily. All right, hello and welcome. Thank you so much for joining our webinar today on understanding substance use stigma in rural areas. Today's webinar is brought to you by the Great Lakes ATTC and SAMHSA. The Great Lakes ATTC and PTTC are funded by SAMHSA under the following cooperative agreements. The views expressed in this training are the views of the speaker and do not reflect the official position of DHHS or SAMHSA. The ATTC network uses affirming language to promote the promises of recovery by advancing evidence-based and culturally informed practices. A few housekeeping items for you all. If you have any technical issues, please individually message me, Alyssa Kuala, in the chat, and I would be happy to assist you. Any questions for the speaker, please utilize the Q&A section of your toolbar. At the end of today's presentation, we will take some time to answer those questions. If captions or the live transcript would be helpful, please locate that option using your Zoom toolbar. At the end of the presentation today, you will be redirected to a very short survey, and we would greatly appreciate it if you filled that out. Certificates of attendance will be sent out to all who attended today's session in full. The recording and slides will be made available on our website by the end of the week. If you would like to stay connected with the Great Lakes ATTC, follow us on Facebook, check out our LinkedIn. We also have our YouTube channel and our podcast channel. And I'm super excited to hand this over to our presenter, Humberto.
Thank you, Alyssa. And I am going to share my screen right now and make sure. Can you all see this?
Looks great.
Okay, thank you. Okay, once again, good afternoon, everybody. My name is Humberto Carvalho. I am originally from Brazil. You may be trying to guess my accent. And for the past over 30 years, I have actually been working on the public health field. I work in public health in Brazil. I worked here when I moved to US. And during my time here in US, I have actually worked for many government organizations. I have worked for CDC, I have worked for SAMHSA, I have worked for NIH in several capacities. And at one point in my career, I actually worked in Vietnam. I was there for 5 years. Working with CDC and also with SAMHSA in projects related to substance use, implementation of substance use programs in the country. And what I'm going to be talking to you here today, understanding substance use stigma in rural areas, it's actually a very interesting subject because a lot of the work that I did, especially in Vietnam, it had to do with breaking stigma, and I think that's actually something that actually is present all over the world. And everything that I'm going to be discussing here with you today is based on my experience on the work that I did throughout my career in Vietnam, here in US, and I hope that this is going to be useful for you. So as a presenter disclaimer, I just want to assure you that the views and opinions expressed here are those of the author, which is myself, and do not reflect those of any affiliated organizations. So for today's presentation, my objective is that we're going to have a discussion about cultural, social, and economic factors that contribute to stigma in rural areas. We are also going to examine the real-world effects of stigma, including barriers to seek help, isolation, and increased suicide rates. And we are also going to share some strategies for reducing stigma, including community-based initiatives, policy change, and personal advocacy. And at the end of the presentation, I'll be very happy to take questions. So before we start talking about stigma, which is one of the issues, let's just take a look of the way of life in rural communities. I'm sure that many of the participants in this webinar today, you probably work or live in rural areas. But if you don't, here are some aspects of rural life that we need to take in consideration when we talk about any issues related to implementing public health programs in rural areas. First, there's the pros of rural life. As we all know, rural areas are usually tranquil, usually a scenic environment. The communities there actually have a very strong sense of community, the individuals. It's like a slower, more relaxed pace of life. And sometimes there's a lot of opportunities to connect with nature, which is something that is very attractive to a lot of people, which actually is one of the reasons, especially after the pandemic, that a lot of individuals in the US have actually transitioned from living in urban areas and they went to more, small urbans or even rural areas, especially because of the ability to telework and other advances. Now, with all the great, pros of living rural life, everything also has their issues, their cons, and one of the cons of living in the life in rural communities is the limited access to many types of amenities and services, including healthcare. There's also increased reliance on personal transportation. As we know, transportation in rural areas is something that is very challenging. There's also a potential for isolation and limited social opportunities. And there's also, in some occasions, a higher cost for certain services, especially if you talk about healthcare services, because of the lack, if you have to rely on private, using private offices, it turns out to be more expensive. So now, in terms of substance use, if you think about substance use in rural area, as we all know, in rural communities is being actually constantly reported as a growing public health concern, the substance use in rural area. But often overlooked that, because a lot of people actually still believe that urban centers, they actually have more substance use issues. And in reality, it's not the case. So, substance use and misuse have long been prevalent in rural areas. And in fact, as we all know, overdoses have increased tremendously in rural areas. Also, rural adults have higher rates of use of tobacco and methamphetamines, while opioid use has grown in thousands every size. And there's also a common fact and known fact that rural adolescents and young adults, they actually use alcohol in much higher rates, and they're more likely to engage in risk behaviors and also binge drinking, which is a very common practice from youth in rural areas. And also they are prone to more risky behaviors in all nature because of the nature of rural areas. Now, we can't talk about substance use and not talk about suicide. So suicide in rural areas, have been alarmingly high, and since, 2000, between 2000 and 2020, the rates actually increased 46% in non-metro areas compared to 27% in metro areas. If you compare this data with the data from 2 decades ago, the number of suicides have increased enormously in rural areas. And especially if you look at tribal communities, it's even higher than what's presented here. So now, among all the issues that exist in rural areas, we're going to be focused today on stigma. Now, what exactly is stigma? If you look at the definition of stigma, it says that it's a set of negative and unfair beliefs that a society or group of people have about someone or something. This is pretty much the basic Webster Dictionary definition. But there's a definition from this author, Irving Goffman, who says that stigma is an attribute that is deeply discrediting, an undesired differentness that affects social situations. And the interesting part of this definition to me is that it says it's an attribute that is deeply discrediting. It's a feeling where people, they feel lessened, or they are also discriminated by others because others think of them as less, lessen. So, it's a very undesirable feeling. Stigma is a very undesirable situation. So, but what exactly is the role of stigma in rural area? Stigma plays a very powerful and sometimes invisible role in shaping health outcomes in rural communities. It creates barriers to seeking help, especially in mental health and substance use, and is deeply rooted in cultural norms and structural change. Stigma can play a lot of role in, with individuals who use substance, who have mental health conditions. Also, there's a lot of stigma focused on lifestyle choice. As we all know, for instance, single mothers sometimes they suffer a lot of stigmatization for being single mothers. There's also stigma related to sexual orientation. LGBTQ plus individuals often are stigmatized because of their sexual orientation. And there's also stigmas related to disabilities, which is also very common. And this is all can be deeply damaging. And its effects can actually have deep impact in individuals, in the families, and in fact, in the entire community. So, understanding how stigma manifests in rural communities and the myths associated with it's very important. There's actually a quote that I just want to read to you that says, "Stigma is more than just a label. It's a powerful social force that can shape how people see themselves and how they are actually treated by others." So, stigmas in rural communities often wears a quiet, familiar face. It's are woven into everyday interactions, also in the cultural values and even the physical landscape. You know, so especially if you think about stigma related to substance use and mental health, and how the misunderstandings and the myths that other individuals have in regards to substance use and mental health. You can see how this is actually a true uh, statement. So. Now, how is it that stigma can influence substance use in rural communities? And again, stigma is present not only in rural communities, obviously it's present everywhere. However, because of the nature of rural communities, it actually has a much more powerful effect. For instance, in privacy concerns and social isolation, for instance. As we know in terms of privacy, rural areas, they are much smaller. They are like close-knit communities. There's a heightened fear of judgment and scrutiny, and there's a fear of being labeled or ostracized. And actually, I like to use an example. I live actually an example that happened to me just to illustrate. If you're not a resident of rural area and if you don't understand when we talk about private issues, I'll just give a quick example of something that actually happened to me. I live in a community, a small community. It's a very small town that has a little bit over 1,400 individuals. It's pretty much farms. And because of the nature of my job, because I have worked as a government contractor, as a private consultant, and also as a government official, often I have to undergo security clearance. And because of where I live, the last time that I had to do a security clearance, this investigator came to my town and he wanted to meet with me for an in-person interview. And because he couldn't come to my house because it's not part of the protocol, we had to meet in a public space. And the only public space that was available was the police department of the town. So then when I got to the police department, there wasn't an office available, and the only area that was available was that little interrogation room that you probably have seen on TV that has a little table that has a camera on the top where they interview individuals who are suspicious of criminal activities. So we sat there and we talked for about 1 hour. I answered all the questions. Done. I left. I came home and I was working. And in the afternoon, one of my neighbors came and knocked at my door and said, "Oh my God, I heard that you were being interviewed in the police department. Did something happen?" So that's just to illustrate how things are really in a rural community. I was like, no, I was just undergoing a security clearance protocol interview. But people talk and everything, information goes around very quickly. So privacy is a very, big concern when you think about stigma in rural areas, and also social isolation. The fear of judgment. It prevents people. The fear of judgment. It actually prevents people from reaching out for support, which is essentially problematic in rural areas where social networks may already be limited. Stigmas push people further into isolation, increasing the risk of substance misuse and making it harder for them to recover. So. Uh, Now, how is it that stigma influence culture and normative influences in a community? So let's think about the traditional values. In many rural communities, there's a strong cultural norms around self-reliance and resilience, which may discourage individuals from seeking help. The belief that one should be able to handle their problems without external intervention can exacerbate feelings of shame and guilt. There's also conservative views of substance use. As we know, the perception of substance use as a moral failing rather than a health issue is very prevalent in rural areas. The misconception from community leaders, from families, and even in schools, it's something that actually is very prevalent in rural area and is a big issue in order to overcome stigma. Stigma also has an influence on the limited access to resources. For instance, the scarcity of healthcare service. You know, uh, in rural areas, access to healthcare, mental health, and substance use treatment services is often limited, as we know. So this means that individuals who experience substance use disorder, they may not only be stigmatized, but they also lack the resource that they need to address their issues. And there's also the distance and transportation issues. A lot of the times in rural areas, uh, health clinics with specialized care, they are actually very far away. Some areas in the country where I live, for instance, I call it privileged rural because I'm lucky this area here has a very nice hospital that serves the communities around where I am, but we're also close enough to Concord and Manchester, New Hampshire, and also to Boston. We're only 2 hours from Boston. If you look at the Midwest and several other areas in the country, the closest health clinic sometimes can be 3 to 5 hours away from a community. So also how stigma impacts on recovery and treatment. you know, the reluctance to seek treatment. If an individual feels stigmatized, they are not going to be looking for treatment. They're going to try to deal with the problem by themselves. The fear of judgment, the ridicule or rejection. It often ends up in delaying seeking treatment that can lead to worsening addiction and greater health risks, including overdose. There's also, treatment barriers now. Even when treatment options are available, the stigma can undermine the effectiveness of the recovery programs. Because you have to remember also how the providers talk to the individuals. In the beginning of this slide, this presentation, you saw words matter. How individuals are presented, how is it that the providers are talking to them? You need to make sure that you're using language that does not stigmatize the individuals. People may feel reluctant to participate in group therapy or support groups because they fear that they will be judged or misunderstood. There's also some intergenerational effect. For instance, there's something called the family stigma. The stigma associated with substance use can affect not only the individual with the substance use disorder, but also their family members. Parents may feel shamed, leading them to withdraw themselves from social networks and avoiding seeking help. It's not only, the shame that they may feel from having a child that is struggling with substance use may isolate them because they also feel they fear to be judged because, oh my God, how can you have a child or someone who is using drugs? And this can create a cycle of secrecy and silence about substance use, preventing the families from addressing the issue in a healthy way. There's also generational transmission. In rural areas, substance use may be something that is normalized within some families or community. There's a lot of families that drink a lot, they smoke a lot, or they even use some other types of drugs. It's normalized, and sometimes the stigma, the individual who is part of this family, they feel that if they get out of that, they're going to be stigmatized by their own family because they're trying to avoid. In Vietnam, in one of the works that I did there, it's very common for especially young boys, like 12, 13-year-olds, they are peer pressure to smoke because it's a sign of becoming a man, to drink alcohol and smoke cigarettes. And if they don't do it, they feel that they're outside of the group of the boys. So that was one of the big issues that we had in Vietnam in order to break the stigma about drinking and smoking with children. So there's also the effect on community economic consequences of stigma, impact on community cohesion, the ability of all communities to function and grow together. Instead of addressing substance misuse as a public health issue, it becomes a moral issue. And instead, even though people see the things are happening, they just pretend that it's not there, which is very common. It perpetuates the isolation of individuals who use substance, making it harder for them to seek help. And there's also economic consequences. Rural areas are usually, not all rural areas, but a lot of rural areas, they have high levels of unemployment, they have lack of educational opportunities, and other socioeconomic stresses can increase the likelihood of substance use. So stigma prevents these issues from being addressed in an open, solution-focused way. Again, showing the pressure of the society in a rural area. Now, there's also, stigma also affects public health approach and preventive measures. In terms of preventive strategies, for instance, stigma can hinder the implementation of preventive strategies. Programs such as like needle exchange, safe space, or overdose prevention education may be perceived as controversial or unnecessary because the individuals who are, in powerful situations, in managerial situations of the community, they don't feel as a necessity because they themselves they feel they stigmatize. They say, well, why are we going to do this? Because we should be focused on something else. The reluctance of embrace preventive approach limits the effectiveness of public health efforts in reducing the harms of substance use, and also education and awareness. The lack of understanding about substance use disorder as medical conditions can perpetuate stigma, and that goes for schools, for churches, think about community halls, the meeting, town meetings. Nobody would discuss that because they don't want to be seen as somebody promoting something that is undesirable. Public education efforts that promote awareness about addiction as a chronic disease rather than moral failing are crucial to changing attitudes in the rural community. And we're going to talk a little bit about this later on. And also how stigma affects policy and advocacy. For instance, underreporting and data gaps. If the individuals are stigmatized and they're feeling ashamed, they're much less likely they're going to open up to their doctors, to their providers, or to public health practitioners that they are struggling with the use of drugs. Therefore, data go unreported, and inaccurate data, which hinders the development of effective policy and resource allocation. If a community has a huge number of unreported number of individuals who have specific issues, that issue may go, not be relevant for policy decisions. And also advocacy challenge, advocacy efforts for improved substance use treatment and prevention service may be more difficult in rural areas due to the stigma attached to substance use. Again, you need individuals with influence to advocate for policies, for policy change. Community members may be less likely to support funding or policies that address addiction if they perceive it as a personal moral failing rather than a health issue that requires public intervention. And to me, this is the most important of all of influence of stigma is the psychological effect of the stigma. Especially on the individual who is suffering the stigma. Stigma can have a profound psychological effect. Often leading to feelings of shame, isolation, and decreased self-esteem. And also, when individuals experience stigma, they may internalize negative perceptions, which can contribute to anxiety, depression, and even avoidance and behaviors. The fear of judgment or rejection can discourage people from seeking support or expressing their true selves, reinforcing cycles of distress. And also over time, this emotional toll can affect the overall well-being of this individual, their relationships, and the entire life and opportunities. So these are all, negative effects of stigma. Now, what are some strategies? What it is that we can do as a community to reduce stigma and try to improve the situation if this is something that you experience? Obviously, the most important, the first step, it will be to create a community education awareness campaigns. Create like workshops. That will educate the community. Make use of schools opportunity, parents meetings in schools. Make workshops available through the town hall meetings or even through church meetings. Church facilities are usually a very good space for these types of events to happen. And even libraries in rural areas sometimes can be a very good place that you can host workshops. Conduct town hall meetings and discuss stigma. Bring people to share their stories, to to show the individuals that especially people in recovery, they can share their stories and say, look, there is a pathway for people to recover, and there's this, and share their stories to encourage people to change their minds and educate them. Use educational programs to dispel myths and use local media outlets, including radio, newspapers, and social media, to spread awareness. Again, educating the community is one of the first important steps in order to change stigma. The next, strategy is empowering individuals and advocacy groups. Support peer-led activities where individuals share personal experience. There's nothing more powerful and more connective, and that creates more connection than if you're talking to someone who has experienced what a person is experiencing. It opens up the ways for you to feel more comfortable to discuss your problems, your issues, your concerns, and there's this feeling of relatedness with the person. So then peer support initiatives is actually very important. Also, encourage community members to advocate for inclusive policies and service. Make sure that the policies and services around taking consideration all backgrounds from the community and all it's providing support. Even consider individuals with disability, for instance. You need to make sure that all the platforms available to provide support, they are addressing the issues and the needs of the individuals who needs the support. Also, identify what I call the community champions. And this is actually one of the biggest strategies that we use in Vietnam. Okay. What I call a community champion is typically, refers to individuals or even organizations dedicated to supporting those recovering from substance use disorder or mental health. They're members who advocate for and promote resources and support for recovery. Who are the community champions? They are individuals with lived experience, and again, which are people who have personally experienced substance use and recovery, because they can provide like an invaluable support to help reduce stigma. Also, professionals in the recovery field, workers and treatment centers, prevention programs, and other recovery-focused organizations can be champions by providing direct service, advocating for policy change, and connecting individuals with support. Also, it can be a community member. Any individual who actively works to create a more supportive environment for those in recovery can be a champion. This could involve like rising awareness, advocating for policies, or simply offering support for individuals in their community. There's some important traits for someone to be called a community champion, which one is have lived experience with recovery, either personal experience or through a loved one. It could be someone who actually experienced, have relatives or children or parents who use substance, so they have lived through that experience, so they can be but it's important that someone understands the issue. If you're going to be a champion in a community to drive a change, you need to understand the issue. You also need to be a respected and trusted person by others in the community, because you need to be someone who people can listen to or are willing to listen to. And it needs to be someone active in local networks like faith groups, schools, civic organizations, or volunteer efforts. It needs to be someone absolutely willing to speak out on reduced stigma around substance use and mental health, and someone who can create collaborative and inclusive uh, connections, able to bring people together and across all divides, because you're going to face people who are against some of the activities. Again, identifying the champions is a very big step to move forward. Also, strengthening healthcare and social networks. Train the healthcare professionals to address stigma and improve accessibility. And by training professional healthcare professionals, I don't mean only the actual provider who is prescribing a treatment. I'm talking about everybody who works in a healthcare facility, from the person on the front desk. Because you have to remember, when the individual arrives to a facility, the first person that they will interact with is someone who's going to look at the system to identify the appointment for the individual, and they see what the individual are there for. And if the patient experiences some sort of stigma from that person, right away is already shut down from the beginning of the whole process. Also, develop partnerships between local organizations, substance use, and mental health service, which is very important. Encourage open conversations. Again, stop pretending the problem does not exist. Let's talk about it. Promote storytelling initiatives that allow individuals to share their experience. Create situations where people can come, even if it's people from outside. If you can't have someone from the community willing to initially talk about it, bring someone from outside. Create safe space for discussions on mental health, socioeconomic status, and other stigma-related issues. And again, it doesn't only have to be about substance use. It can be about anything. As long as, open communication is actually a door opening for improvements in any community. Also, policy institutional change. So how do we implement policy and institutional change? Advocacy for inclusive workplace practice. Make sure, for instance, one thing that you can implement is every employee in the facility has to take annual trainings on anti-stigma strategies, so that people understand stigma and actually do not, create issues for the individuals coming. Create anti-discrimination policies, also accessible healthcare. Make sure that, open opportunities for instance, telehealth, which is something that is actually, brings specialized healthcare if the community doesn't have. Also, work with local governments to improve funding for support service. Look for grant opportunities. And one thing that I always like to remind communities, because sometimes they say, well, we don't have a means to apply for grant. Well, if you feel that you don't have a means to apply for a grant, connect with nonprofit organizations. There are many nonprofit organizations that can help you to apply for a grant. Even if they apply on their name, but they will focus the work in your community. So partner with individuals or organizations that actually have the experience of writing grants. Now, to illustrate all of this, I dig out like a case study, showing the impact of stigma on substance use in rural Appalachia. I think I like to introduce case studies because it actually illustrates what we are talking about and open opportunities for you to think about, because you can actually relate to it. And what I'm going to be talking about here is actually a case study that is probably common across, and some of you may actually have experience what we're going to be talking about. So the background. So I told you we're going to be talking about the catchment area, which is the rural Appalachia, which is a culturally rich and geographically diverse region. It's located within the Appalachian Mountains, stretching from southern New York all the way to northern Mississippi. It includes parts of 13 states, and a lot of these areas, they have rural communities throughout these states, especially in Kentucky, West Virginia, Pennsylvania, and Mississippi. And the socioeconomic status of this area, this area has long faced economic hardship. It has high unemployment rates and significant prevalence of substance use disorders, particularly opioid addiction. In this region, also cultural and social factors contribute to the stigmatization of individuals who use substance, making it more difficult to address the issue effectively. So we're going to use a community, as an example, but this is a fictitious community. I did not want to pick any specific community to put them in evidence. So this is a make-believe community that we're going to call it Maple Ridge, which is a town with 3,500 individuals, okay, people. And this town has, the key issue of this town is that they actually are experiencing high unemployment, limited access to healthcare. They are having a very serious opioid addiction epidemic problem, and they also have strong traditional values. This may resonate with some communities you may be aware of. So the cultural characteristics of this town is they are a close-knit, deeply religious and community-oriented, and people in Maple Ridge, they hold traditional views about personal responsibility and moral values. So in terms of healthcare access, they actually have one small clinic serving the entire population with limited mental health and addiction service. And the nearest treatment center is actually over 50 miles away. Again, it may resonate with some communities that you may be aware of. So what's the problem? So there was a rise in opioid addiction over the past decade, largely due to the increased availability of prescription painkillers and later heroin. Despite of high number of people struggling with addiction, the stigma surrounding substance use is pervasive. So the town's leaders and healthcare professionals, they acknowledge the issue, but most residents believe the addiction is a moral failing. In other words, they're watching the issue, but they really don't want to talk about it. They believe that it's a moral issue and that that they shouldn't be touching the subject. So this belief is deeply ingrained, and there is a reluctance to openly discuss the issue or offer public support for treatment programs. So that's the profile of the town. Now we're going to look at a specific case, the impact of the stigma in this particular community in one individual who we're going to call Lila. Okay, again, it's a fictitious individual. This is not a real person. Lila is a 29-year-old woman, a single mother, who began using heroin as a way to cope with stress and anxiety after a very difficult divorce. So she had struggled with depression and trauma for years, but found little support in her community. So Lila avoided attending any group therapy or support meetings because of the judgment she anticipated from people in the town, because she knows how the people in the town is. She knew that if she start going to group therapies or meeting, that she had this fear she would be judged. So she felt that any attempt to ask for help would only reinforce the stigma and lead to further alienation. Again, this is from the perception of the patient. So what were the barriers for treatment and recovery in this situation? The fear of judgment. Many people in Maple Ridge, like Lila, they avoid seeking treatment due to stigma surrounding addiction. So it's not only her, it is something that's, prevalent in this town. In Maple Ridge, people are afraid that their struggles with substance use will be seen as personal failure, not a health condition. And for Lila in particular, the idea of attending treatment or even talking about her addiction was intimidating, because she feared being viewed as a less of a person or even as a bad parent, given that her children were well known in the community. So continuing with the barriers of treatment, there's also the limited resource that the town currently offers. Like I mentioned earlier, the nearest rehab facility is over 50 miles away in a neighboring town. And transportation is a significant barrier. Even if she wanted to go, it's difficult to get transportation to there. So the clinic in Maple Ridge offers limited addiction service, and the town's primary care physician lacks specialized training in addiction treatment. Also, most residents, including Lila, they cannot afford private treatment, and the stigma around addiction makes them hesitant to use public funded resources. There's also the cultural barriers of Maple Ridge. The community's strong cultural norms around self-reliance and personal responsibility create additional barriers. In Maple Ridge, people are expected to pull themselves up by the bootstraps, which is something that you hear in a lot of rural communities, rather than seek external help. And this is very common, a lot of times very common, especially in men. They expected to be strong personalities, that they shouldn't require help from outsiders. So Lila, for example, she had been taught to handle her problems on her own and felt an overwhelming sense of shame about needing outside help, which is very common. And this is not something that's only common in rural areas, also in urban areas. A lot of people feel ashamed to look for therapists, for instance. So what was the community response to the challenge? Again, the local leaders' hesitation. In Maple Ridge, the local leaders, including the pastors, the teachers, and community organizers, they understand the seriousness of the opioid epidemic because they read in the papers, they see on the news. But many are hesitant to publicly address it because of the norms of the community. The health clinic efforts, for instance, the local health clinic, they actually have attempted to offer addiction treatment and to introduce prevention programs. But these efforts have been undermined by the town's reluctance to engage with such services and programs. They can't put programs if nobody's willing to participate. But, luckily for Maple Ridge, there was a turning point. Somehow, a new public health initiative funded by state-level efforts, they arrived in Maple Ridge and aimed to reduce stigma and promote preventive practice. This initiative included a series of community workshops on addiction as a medical condition, featuring personal stories from people in recovery and healthcare professionals who emphasized the importance of seeking help. They used radio campaigns. They did engagement with the schools, with the parents, with the students. They also did engagement with the community centers and local parishes. They were able to engage the individuals who have a stake with the community. So community support. So how did the community respond to that? Slowly attitudes begin to change. Again, one thing that I always introduce when I'm talking about implementation of public health program is that don't expect that anything is going to happen overnight. Sometimes there's a very long phase between implementation and seeing results. Public health implementation programs is something that takes time and takes a lot of persistence. So in the case of Maple Ridge, slowly attitudes began to change. A few brave residents, including some who had struggled with addiction, they began speaking out public about the experience. They felt confident. Once they hear those informations, when they get educated about it, they start feeling more encouraged to talk about it and say, look, I'm not a bad person. This is a struggle that I'm going through. So these voices alongside the public health initiative help reduce some of the stigma. It's just the beginning. So a few community leaders, including local pastor, agree to address addiction in a more compassionate light, reframing it as a public health issue rather than a moral failure. Again, they were able to educate a community leader like the pastor in order for that person to be comfortable to talk about and talk in a compassionate way that will not push people away. So improved resource. Over time, the clinic began offering expanded services, including telehealth consultations with addiction specialists, and partner with a nearby rehab facility to offer transportation options for those seeking treatments. So slowly, everything starts changing. With the stigma somewhat reduced, individuals like Lila began to feel more comfortable reaching out for help. So as an outcome, let's focus on Lila's recovery. Well, after all this implementation, all these programs efforts, Lila, seeing the positive change in other community members' life, reaches out to local clinical help. Again, see the experience of someone watching somebody's life improve, which is a very powerful reference. She's initially apprehensive, but receives compassionate care that helps her address her underlying trauma. At that point, she was encouraged, she felt encouraged enough to go seek for treatment, but the people she met treat her compassionate, treat her in the right way. They made the environment inclusive so that she was actually comfortable sharing her struggles and accepting the steps that would lead her for her recovery. And over time, she became an advocate for addiction recovery in her community and begins speaking at local meetings to help others understand the importance of breaking the stigma. So what's the conclusion of this case study? So the stigma around substance use in Maple Ridge had a profound effect on the community ability to address the opioid crisis. For years, people like Lali struggled in isolation, unable to seek help due to fear of judgment and shame. Also, with time, education, and a concerted effort by local leaders and healthcare providers to reduce stigma, the community began to change. And again, it's not an overnight change. Things go slowly. So what this case illustrates, this case demonstrates the importance of reducing stigma to improve access to treatment, foster community support, and ultimately help individuals recover from addiction. Now, if you think about implementing, if you're thinking now about implementing a program in your community, there are many ways that you can go on in creating a program or partnering with organizations that can help you to create a program. But what I'm going to give you here is a simple 7 steps that you can take as the first blueprint for you to create a program. The first step, if you're trying to reduce stigma in a community, you need to understand the stigma. You need to do needs assessment, partner with organizations, create a plan, create a goal. But one thing that I always tell people is once you create goals, don't create goals that are unreachable. Start small. Start with small steps, because if people create goals with ambitious goals, midway through or even the beginning, they see that it's not going to happen. It's very discouraging in actually prevent people to move forward. And a lot of programs, they have failed because they had ambitious goals. But the first step is to understand the stigma in your community. Who is being impacted by it? Where are the sources of the stigma? Is it only from the members of the community, or is it also in the school, or is also at the clinics where people are going? Second step, once you understand, you have a picture of what's going on in the community, and you actually have a goal in place, you start creating education and awareness campaign. You need, make use of the uh, uh, town halls. Use the platforms that are available for you in the community, town halls, the church, the library. Use the platforms that you can actually where people gather, so that you can actually have opportunities to educate and create awareness campaign. And especially if you talk about young individuals, youth. Youth, one of the very powerful and successful strategy with youth is having them design the awareness campaign, because it comes from them. It's actually they feel their own, they feel ownership of the programs, and they actually it's much more effective. Also, community engagement. Again, make sure that everybody in the community is engaged. You need to use this engagement to break the misconceptions. And again, the fourth step, which is, again, challenge misconceptions. We are always going to face resistance from some source, from some individuals, especially if you face misconceptions from individuals who are powerful individuals in the community, or who are someone with influence. You need to find a way to turn around and educate those individuals, so that they can actually change their mindsets because of the influence that they have, so that they can actually help you to move your program around. And also, step 5, empower affected individuals. The moment that you empower them, treating them in a compassionate way, giving them the platforms for them to stand on their own and drive their own recovery process, it becomes a much more efficient and effective process. Step 6, focus on the policy and systemic change. What it is that needs to be put in place. Who do we need to contact in order to implement policies? Create, substance use free zones, for instance. Let's implement a substance free zone, or make systemic change. Let's create programs that will provide ability for individuals. Let's bring telehealth for the common clinics to provide specialized care that is not available in the community. So make change that we actually provide platforms for sustainability. And again, last step is whatever program you decide, whatever pathways you decide to implement a program in a community, you need to think of sustainability and impact and evaluation. You don't want a program that will be in place only for a very short time. You need something that will be sustainable, that will continue, and that will have the means to evolve over time. And for that, you need to do needs assessments over time. You need to do, collect the data from the population, from the schools, from the clinics. Even we partner with the police departments, see if there has been arrests of underage drinking or DUIs. Gather data and do an evaluation to see how well your program is actually working. Are you moving to the right direction? Are you actually creating positive outcomes? Again, this is just a very simple blueprint that can be expanded based on how you want to implement a program in your community. Now, one thing, the key to make change is absolutely engage in the community. For you to engage the community, you actually need to build trust through local leaders. I talked about the people of influence. I talk about the champions. And a champion can or may not be a person of influence, but if you can build their confidence enough, they become a person of influence. Also, use accessible communication channels. You need to talk to people in a language that they understand. If they, and you need to access the people. If this is a community that is very strong in podcasts, well, use podcasts. If these are people who are more likely to listen to the community church leader, go to the community church leader, use their voice. Create community-based programs. There are many community-based programs out there that have been adapted for that has been shown that they are much more effective in rural settings. Create these programs and adapt them for the situation of your community. Also, offer incentives and practical benefits. One thing that is actually, if the issue in the community is that you can't bring providers there, offer them some housing incentives or some practical benefits. You can come work in the community 3 times a week, and create a possibility for the systems to fall in place. Leverage storytelling and personal connections. That's how you engage the community. Showing them strong stories. There's nothing more powerful than storytelling, and that's why I always use case studies, because people always relate with the case, with the stories, and they actually connect with something else that's happening in their lives. And storytelling is very powerful because creates a platform for people to be more compassionate about others, and address barriers proactively. Again, do not pretend that it's not there. Do not ignore the issue. You need to face it and address it properly. And also ensure long-term commitment. Engage in the community. You need to create platforms that will create the programs, the implementations of the service, whatever you're going to put in place. It needs to be something that is sustainable, and you gain the commitment of the community, that they will all participate from it. So this is pretty much what I had to say, that I plan to bring here today. Again, this is a much broader subject. We could be talking about different aspects of stigma for hours. But I'm going to stop here, and I'm going to see if there are any questions. I'm going to stop sharing, and I'm going to ask Alyssa to let me know if there were any specific questions.
No questions right now, so everyone on the call, please take some time to utilize the Q&A section of your toolbar and pop in any questions you might have. As we wait for, here's a question. Oh, this one's for me. I did put some reminders in the chat for you all. If you could please take 2 to 3 minutes to fill out that post-event survey in the chat. You will also be redirected to the survey. We would greatly appreciate your feedback. The recording and slides will be on our website, and certificates of attendance will be sent out via email to all who attended today's session in full. This can take up to 2 weeks. So you have so much praise in the chat, Humberto. Everyone's saying thank you, and you did such a wonderful job. So I really appreciate you
Thank
taking the
you.
time to chat with us today.
Oh, my pleasure.
I'll give folks just a couple more minutes to think of any questions they might have. Everyone just keeps saying thank you, and it was a fabulous presentation. So very informative. Just lots of great feedback coming right now. No questions. All right, wonderful. Like I said, there hasn't been any questions in the chat for you, Humberto. So we will wrap up today's training, and please look for the recording and the PowerPoint on our website by the end of this week. We hope to see you all on future trainings.
Somebody is asking here, where can we access more case studies? There are several websites. CDC website has some case studies, but if you generally Google case study, if you Google case studies on community stigma on substance use, you're gonna see several links or several platforms that provide sets of case studies. I find case studies very useful. You can find them in many places. I think it's a very good way to highlight some subjects that you want to talk about. It gives you a sense of connection to, you know.
Berto, thank you so much for sharing with us today. This was a fantastic hour, lots of praise, and I want to echo everyone saying thank you, great presentation, all good stuff, and we really appreciate it. So thank you so much.
Thank you all and have a great rest of your afternoon.